In this video, I'm going to show you 3 hip stretches you must be doing for degenerative disc disease of the lower back. Hey everyone, I'm Sebastian at Performance Play Sports Gear, part of the locally world-famous chiropractors in Costa Mesa, California. Now the reason why doing hip stretches is really important for degenerative disc disease is because typically people with degenerative disc disease have too much spinal movement, generally speaking. They use their low back too much. One way we can reduce symptoms and, we believe, progression is to make it so, number one, we can stabilize the spine with certain exercises or activities, which usually need to be hand selected because it shouldn't have to hurt, they should be hard. And the second thing is we can make it so the hip works a little bit better. Typically, step one in sparing the spine from too much activity is to make it so the hip has more range. And those 3 exercises I'm going to show you today are one way we can reduce sensitivity of the lower back by improving hip range of motion. But to be clear, adding hip range of motion typically needs to be supported range of motion, active range of motion. And doing those exercises to create hip strength need to be done a little bit later. The first stretch you're going to do is one that many of you have seen before. It's a hip flexor stretch, but before you tune out and say, I've done this one before, just know there's a certain way to do it when you're dealing with degenerative disc disease. Usually, the number one rule is let pain be your guide. If anything hurts your back to do it a different way. Normally, just slightly changing posture is very helpful. And so the first thing to do, I'll go straight sideline view with you just so you can see here. By the way, you're going to want a pad for your knees. This ground is really hard, but I'm going to suffer through it in the video for you. First thing you want to do is you want to take a generous split stance here, all right? Your knee will probably be a little bit further back than your hip pocket. And the way you can fine tune this is I'm going to take my foot in the front here and I'm going to use my toes to inch myself forward. I actually have a thinker position, like the statue, the thinker. And what this does is it helps out to allow the back to settle down and relax while you're doing the hip flexor stretch. So now that I'm in this position here, we're going to rock through range a little bit. And I'm going to do that by taking my hip pocket and trying to pull it towards the ground, and then I'm just going to rock the pocket towards the ground. Doing this, I mainly just feel right here. It feels stiff, it feels stretchy. It doesn't make me scream, it just feels stretchy. And that's okay. Now, if you have problems down into the inner part of the thigh or into the knee that's not related to the pressure on the ground, this may be something you don't want to do because this actually tensions the femoral nerve, which many people with degenerative disc disease have problems with, or the little nerve roots that go out of the spine creating the femoral nerve sometimes are sensitive and not tolerant to stretch. And so this is one way to do the hip flexor stretch here. Normally we do about 50 reps a day roughly, broken up into bits. Another way to do it too is you want to take your foot and flare it out towards the camera just a little bit. If there's a balance issue, you can use a bed or an ottoman, and then you rock into it here. This just feels a little bit like I can't move as far, and that's okay. I'm just rocking through the range that my hip can tolerate, okay? What we're doing is we're trying to expose the hip to a little extension. The hip flexor does get a stretch in the meantime too, but also the front side of the hip capsule too. Sometimes when people aren't really walking too much and they're not super active, their hips get a little frozen, if you will. They feel a little sticky, and the body adapts over time, and the capsule can become a little fixated. And so we're just going to allow the hip to drop into some extension to stretch all of the structures in the front, including the capsule here. The next thing we're going to do is we're going to do a hip capsule stretch in the front. Some of you may have seen this before too. Again, there's a slight flare on the way you should do it. And so we're going to go here, and just for camera's sake, I'm going to show you on this side here, okay? And so we're not going to actually pull across our body. I want you to actually let the leg here support the foot, okay? In this case, we're going to take almost like a single or 2 fingers, and we're going to push a little bit this way, okay? It doesn't take much effort. We're going to slowly rock the hip through range into external rotation, which is usually pretty friendly on most people's hips. Now here's the catch with it. To do it well, you have to make sure that you're actually creating a little bit of support here with the rib cage. Now I'm going to flip sides just so you guys can see, okay? In this case, I'm going to take these two fingers and push down to here. Now I'm going to be super dramatic with the fail point, which many people do, is we're focusing on how far to push it versus the quality. And if you can see my rib cage here popping up a little bit into the camera view, every time I push far, you may see the rib cage flare, and then it goes down. Flare, and then it goes down. We don't want that. And so what I want you to do is put your hand onto your rib area and just feel it. And then to give a full exhale, you'll notice the rib cage depresses itself away from your hand. And then I want you to take a deep breath into the abdominal region, almost like you're blowing up like a spare tire here. What you may notice is some of you will say, well, that's really hard to do. I feel like my rib cage is still popping up. Right. And so this is part of what's going on with your back too. And it's also, if you allow this to occur, you won't get any really significant range of motion out of the hip, because what you're doing is you're bending your back in this exercise or this stretch. And so we're going to depress again, rib cage to the floor, hand here as a gauge, breathe into the fingertips, and then we're going to give a little bit of pressure onto this region here. Once you get this part here, you can use a palm pressure here too, and just to rock through range. I know I'm talking through the stretch. You should just be focusing on breathing into the fingers. Don't let people distract you. Focus on breathing into the fingers and challenge range. You'll probably do this again about 50 times in a day. Okay. Now the other thing you can do too is moving the hip into slight flexion here. Okay. I want to warn everybody that if you've done this one before and you feel a pinching in the front of your hip, you should not do this one. Mainly because some people with degenerative disc disease of the lower back have also what we call a flexion intolerant hip, which may be from a labral tear or some type of impingement and so on. In that case, we're just beating this thing up here, okay? We don't want to do that. And so if you have this clear though, you bring the knee towards the chest, take a deep breath into the thigh, same region, and then bring it out. Roll it in, and bring it out. I don't know if you guys are catching the drift or not, but breathing is pretty important in this. It's really important. Essentially, you're going to be spending about 5 to 10 minutes alone doing movements with your hip, stretches with your hip, and breathing. So you really can't be on the phone when you do this. You can't be distracted by the TV too much. Right? And then you do the other side too. So the goal with these stretches is to improve hip range of motion. The next thing you need to do is to make sure that the range of motion is actively supported, meaning the musculature of your hips and your pelvis and your core are all working together to make sure that this is actually something your body does in real life, game time if you will. Okay, passive stretching really doesn't get you anywhere long term, but it's a really nice start to grease up the hip, to take some of the workload away from the low back degenerative disc disease, and it makes it so your back will generally feel better. If you guys are looking for help about how to create a nice program of stretches and exercises to do, we can help you. We specialize in low backs, hips, groins, and the whole lower quarter here at Performance Place Sports Care. We see people virtually and in person, and we've successfully been able to coach people out of having problems virtually, and it has not been an issue for the most part. We're very honest about what we do. I suggest that you guys set up a consultation, allow us to speak to you, and see if we can even help you in your case. At the very least, please take advantage of the webinar that we have in the corner. It's completely free. It gives you some information about lower back pain, different diagnoses that you may have, and I guess I should have mentioned in the beginning, if you're 30 years old and you're watching this, you should really watch that webinar, because most people do not have enough degenerative disc disease in their 30s to really create ongoing problems. It's usually people into like their 60s and 70s that have more of a problem with degenerative disc disease creating the main symptoms that they have. But a lot of times when people in their 30s, they'll have signs of degenerative disc disease in their images, and they panic and they think that's the only thing going on, when there's actually this other thing going on too. We have other videos on this as well. We'll see you guys next time. Subscribe to the channel, like the video. Take care.